So, namaskar everyone, and welcome back to my YouTube channel, and welcome to this series of Understanding Kent in Depth. I hope before watching this video, you all must have gone and watched past my all videos which I have been doing on Kents. The effort, the purpose of doing this series of lectures is to understand Kent in depth, and I'm trying my best, whatever little knowledge I have, to have an understanding of Kent and how we can understand his theories, his lesser writings, works, and convert it into practical aspect. So if you see, I'm talking about philosophy also, but in the same time, I'm also putting down some cases. And after this lecture, also, I'm going to share some cases. And ultimately, let's see how long it goes. Okay, this series goes, and we'll try to pour out all my experience which I have been gained in last 15, 16 years. So when I was reading Kent's lesser writing, there's a very important paragraph where he talks about unfavorable prognosis. Unfavorable prognosis. So it's a very short, maybe 2 pages article. I found it very, very intriguing, and when I was reading it, a lot of things went into my mind. All the cases from the past, all the failures from the past, few successes from the past, a lot of questions also came to my mind. And I felt these questions are also the questions of other people. So why not solve these questions as far as I can do it? So it's a small effort to explore those finer aspects of homeopathy through this article. So let me directly go to the PPT, and I've made some short PPT notes and we'll work through it step by step. So let me share it. So this topic's name is unfavorable prognosis. When a patient comes to us, definitely we want every patient to get better, definitely. And that is our entire whole and soul purpose. We want to cure, we want to help. But I hope you all agree that the type of chronic cases that we are seeing in today's present time, many chronic cases seems to not move as per our direction, as per our desires, and many times the prognosis that we expect does not happen, and that's called unfavorable prognosis. There could be multiple reasons to it, multiple reasons. But what are the reasons what Kent is talking about, and what are the points that I got from it? So this lecture is going to be, this talk per se is going to be sharing of my thought process and all the thoughts that came in my mind, and few points and few questions I'm going to put forth, which you as a physician also have to think about. So where you can find this page 444, chapter 59. So page 444, you will go in Kent's lesser writing and you will find this entire article. So after watching this, please go and read it and think about it. Think about what he's writing and what he's trying to say. So let us start. He says the symptoms and the aspect of such cases as present an unfavorable view and unfavorable prognosis. Now, this is the topic's name, title. He says there are cases where we have got unfavorable view and unfavorable prognosis. So what are those? How do we differentiate? How do we know the symptoms and different aspects of these cases? And then beautifully he narrates 2 words. He says there is one component which is called symptom complex and one component which is called symptom image. Now what is he talking about? Symptom complex. So when you take a case, there's a group of symptoms that comes in front of you. Now that group of symptom can look like a symptom complex or can look like a symptom image. When we say it is a symptom complex, when there is chaos, there is confusion. See, many times what happens, we take the case, we analyze, we repertorize, we do everything, thematize, everything we do. But ultimately, you're thinking of a remedy, but inside your heart, you know that this is not the remedy. Or many times, it looks like 2-3 remedies together and there is a confusion. When this happens in a case, like this happens in physician's mind, after case taking, it means it is a symptom complex. You have got a symptoms, but it is very complex. There is no clarity. Confusion is there. And definitely favorable prognosis is going to be withheld. A physician knows that in this case, I'm going to struggle. Next follow-up is not going to go as per my wish. What is symptom image? Clear symptom image. Symptom image means when you get a totality and it is very clear. The image of the remedy is very clear. So there is a sure index to remedy. So when this happens, there is no confusion. There is clarity. Symptoms are very clear. Keynotes are there. And you can see the remedy in and out, through and through. That is called symptom image. And here, remedy is sure. And definitely when remedy is sure, speedy recovery is definitely there. So when I was reading this, I understood that yes, he's saying right. When I see my cases, in so many cases, either I am landing up into symptom complex or there are few cases where I land up into symptom image. Many cases I am confused. Many cases it's chaotic. Confusion is there. Not clear picture is there. And few cases where symptoms are clear. Definitely, I'm very happy, and I know when I give the remedy, I know that yes, next follow-up is going to be very enriching. Now he says symptoms are same, right? When a patient is same, symptoms are same, then why the perception one way it becomes complex, or like one physician can look at the same case and for him it is a complex, symptom complex. One physician can look at the same totality, for him it is a symptom image. So what is the difference between them? He says very beautifully that the difference is the training and the experience that the person has gone through. So it entirely depends on the training. Now, what training you are being exposed to? You've been exposed to thematic training, you've been exposed to interpretative mind of school of thought, or you have been trained through a very classical approach, and you are trained to read books, going into the literatures. And of course, next is your experience. In experience, everything counts. The cases that you have seen, the cases that you have seen of others, successful cases, and also the failures that you got, the failures that you saw others. So what he says, if you want that symptom complex in your practice gets lesser and lesser and symptom image is more and more in cases, gain knowledge by training, by whatever ways you have. Reading, second says reading, and third he says experience. And out of these three now, I have written experience in bold, because I feel that it is your experience. When you get experience, especially when you fail in the cases, when you take a lot of challenges in your practice and you want to battle those challenges, every day you go to clinic and you feel, oh my God, this case is difficult. You know that you are in the right path, because once you feel this case is difficult, then only you will try to explore it. Then only it will inspire you to go and read. Then only it will inspire you to go and do a training. So training, reading, and your experience. These three components, any homeopath gets into that zone, definitely less symptom complex in your practice, more symptom image, it's going to come. And he says, of course, if somebody is not doing this, training, reading, and experience, case so long in chaos, unfavorable diagnosis. Why he says so? Because I agree with what he says, because I have known, I've seen, sorry to say, but physicians who have been senior into the practice, like 10 years into practice, 15 years into practice, 20 years into practice, many of them just do not read, do not train, or do not, experience, in the sense, if they are failing, they're not looking for solutions. And many of them, sorry to say, means I'm not saying that homeopaths do not train themselves or they want to evolve, but many a times they get attached to some institutions, some school of thoughts which are entirely thematic. And then they go into that theorizing and thematization, and entire chance to become a really good homeopath abolishes. They remain the entire practice, whole life remains chaotic. They will not say, but they know when patient is in front of them. I've seen different prescriptions. I've known people so closely, chaotic, but they cannot move from there to there, like, because. So if this is happening, the question is, if this is happening, I'm not here to point out anybody, but if this is happening, that it means you have to look for your training. Everybody is going through some training and some experience or something they are reading. So if this chaos is more and more, confusion is more and more in your practice, and you're not getting those results, so definitely you have to look for the mode of training that you're going through, the books that you're reading, and the experience that you're gaining. Maybe that is faulty. You need to turn around. You need to change the entire pattern. There is more to be learned about the diagnosis. Then he talks about diagnosis. This is beautiful. There is more to be learned about diagnosis and prognosis by studying the complex of symptoms than by any form of physical examination. Now, when we read Kent, every time you'll see Kent in philosophy, he talks about that we are not treating disease, we are treating the person. The person in the disease has to be treated, not the disease in the person has to be treated. This is the central philosophy of Kent. And all the time we have read this, that you need to be a good diagnostic, doctor, but you should know how to differentiate the diagnostic symptoms from the qualifying symptoms. So the real diagnosis is not the diagnosis that is being done by your blood reports and by your by biopsies or all those things, or scans and everything. That is different story. But he says the real diagnosis is by studying the symptoms. And then he says, but he does not he does not put down the investigation. He says, but all methods of investigation should be used as they confirm each other. So other side, he says that you should examine, you should investigate. In fact, when I was reading, Burnett, somewhere it was written, a homeopath needs to be a very good pathologist. See, you have to understand, Kent himself was an anatomist. He was a professor of anatomy. And this guy is saying that you should not look at disease symptom. Now, you to know what is common and what is characteristic, it is important that our physiology, pathology has to be very strong. Our investigations has to be strong. We have to investigate properly and see where the problem is happening. Maybe many times we don't need to give any medicine also. So one side he talks about that look for the symptoms, but diagnosis, but he says that both are important, but as a physician, like ultimately, see, as a homeopath, I have to give medicine. So my diagnosis is not the diagnosis that he comes with. My diagnosis is, of course, the scientific diagnosis I'll keep in mind. That is important. It might be used somewhere. But the real diagnosis is I have to understand the person in the disease, the symptom complex. And often, where one is defective, the other is strong and helpful. Now, how beautifully he's saying. See what he's saying. He's saying that one way he's saying that diagnosis, that scientific diagnosis through investigation that happens, more than that, symptom complex diagnosis has to be done. Means you have to understand the symptoms. When he says symptoms, it is not just the expression. He says the symptoms in the sense, in the deeper terms, he says is from where the disease is coming, from where the disease started, what is the evolution of disease in this patient. He's talking about everything. You have to understand in a very broader and general term. It is not just one symptom that, I get sneezing from cold. That is just one symptom. But the complex of symptom from where it is starting and why this patient is diseased, why he was suffering from rhinitis, then he had, maybe GIT tract different, then he had kidney disorder. This entire thing has to be understood. That is what I understood. And then he says that the investigation has to be done, because sometimes it can happen that the method that you're trying to individualize may not work. Maybe this other diagnostic feature can help. Now, why did he wrote that? And often where one is defective, the other is strong and helpful. He's saying the diagnostic could be helpful sometimes. That it could be helpful, right? I was reading one case in Kent's lesser writing. He says that adenoids. Now he says adenoids. Now adenoids is a diagnosis, right? It's a disease, right? It's a disease. He says in adenoids in children's, I've used tuberculinum with effectiveness with very good results. And he says that I've been giving tuberculinum to so many individuals, like children who get adenoids. Now, don't you think he's talking very specific in this case? That's the question. That's the question. So, this article, why I'm sharing it? Because the idea that people have got that Kent was a person who always talked about disease in men, disease in men. When they say disease in men, they forget, they just throw out pathological changes, what is happening, the disease symptoms that is happening. Yes, he said we have to individualize, but he never said, and that's what I want to point out, that Kent never said that he should not understand the physiology and pathology. It can be helpful. Okay. So as we are training ourselves to become a good homeopaths and collecting the symptoms, characterizing it, we also should be aware of the diagnosis. Sometime it can help. Let's go ahead. And then he says symptom complex that you have to understand. He says you understand those symptoms urged by Henman. How? You know the symptoms in cause, beginning. It's so interesting. See, purport and direction, ending. The word here, one word is purport. Let's first go to purport. What is that? We'll come back to that slide again. When I looked into meaning of this word, to give an impression of being something or having done something when this may not be true. But without proof, okay, something that appears to be true, but probably in reality isn't it? Isn't it's difficult to believe. So we use the word purport, means those characteristic symptoms he's talking about, which are not real. It looks like how the symptom came in, the concomitants, the aggravations, the unique keynotes. It is unbelievable how this happened. That's called strange, rare, peculiar, and characteristic. Now look at this. He says Henneman has given us a performer where he says you should know a symptom in this pattern. What he says, what are the things that are included? Let's go one by one. He says first cause. Now when we read fifth aphorism, Henneman talks about the fundamental cause in chronic disease and exciting cause in acute disease. But he talks about the cause. Now this is very interesting, because people always say that Kent was a person who always prescribed on mind and mind and mind. And from there, a lot of different schools of thoughts have come up, which I feel many a times they are interpretative. A lot of interpretations are there. A lot of interpretations. You are just putting your thoughts in there. What about Kent? When Kent says cause, what is he talking about? He's talking about like a patient comes in front of you. Suppose whatever diagnosis has come, it is a physician's job to go back and find out from where the illness started. What was the first defect that happened? You have to go back in the past. All the questions that answers that you want, you're going to, all the questions, answers, you will always get in the past. What do you see right now? The expression, the tumor, the ulcer, cirrhosis, whatever diagnosis you're seeing right now, those have to be considered, but you have to go in the past. And when you understand the journey of a disease, then only you will be able to understand remedy. I'm saying something very important here. I'll give you some examples. Do one thing. I've said this many times. Go in Kent today, just now, and randomly open any remedy you want to open, and just read. Just keep your mind aside, your interpretation, and just see the way Henneman describes a remedy. See, ultimately we have to give remedy only, right? How does he describe a remedy? He describes a remedy from modalities, concomitants, that is there, but he describes a remedy from his evolution, the entire general aspect of the case, the entire pathophysiology he describes. If you don't believe me, just go and open Konayam. We know Konayam is for hard mame. Just search and see how many times he has talked about stony hardness, stony hardness, stony hardness. Any hard swelling, mame tumor here, there, tumor, hard swelling, we only think of Konayam. But when you read the initial first page, second page, There's no mention of any tumor. He's talking about conayam as a remedy. How does conayam come in patient's life? What are the things that happen? How did the disease starts? He talks about the paralysis, how to understand the paralysis. It happens in the mind, the slowness, the memory defect in the body, this paralytic state, how it develops. And then, of course, the cardinal symptoms come. Every remedy, you take acetic acid, you take colchicum. I've given this example many times. Colchicum, we know it's a remedy for rheumatism. You go and read today colchicum. See what he says. How disease comes. Patient first gets exposed to cold. Urine stops, slows down. All the toxins get accumulated. And then slowly, the rheumatism or the gout or uric acid things start. And then your other symptoms will come, the characteristic symptom that you talk about. Now, you can term this as toxicological things or pathophysiological thing. The same thing Kent is doing in every case. There are only few remedies where he actually talks about the mind symptom. Like suppose linium tecugo. He will say hurried, wants to be busy because of sexual desire. But when you read linium tech, he talks about the pathophysiology again. He talks about how the disease comes. You read Rustox, go and read Ruta. How beautifully he has said it is exactly like Rustox. It is exactly like Rustox, but in deeper sense, when disease goes deep, tissue changes are deep, in tendons, it is Ruta. So everything Rustox, but it can be Ruta. Go and read Aurum Metallicum. Yes, he talks about societal tendency, lack of love of life, all those aspects he talks about, anger, contradiction, duty, all those things he talks about. But then he talks about the general, where is the sphere of action going around? The bones will be affected, the syphilitic things he talks about. Go and read Hepar Self. If you want to understand Hepar Self, how beautifully he has written. Hepar Self we use so frequently. Just go and read Hepar Self and how beautifully he has written that Hepar exactly mimics like mercury. And Hepar and mercury are very close. And then in between he talks about silica. How silica can, follows well or something is written. So go and read that, right? More you read Kent Materia Medica and try to understand remedy in that terms, you will better understand the remedy, and then better you understand the remedy, the same thing you will try to find out in the patient also. Okay. Generally, we are being taught that we have to look for cardinal symptoms, we have to look for totality, make a totality and give a remedy. That's okay. Suppose a remedy comes pulsatilla. Suppose a remedy, now pulsatilla comes in between. Suppose you know that pulsatilla problem is from puberty. There has to be something in puberty, right? Just patient weeping in front of you, you can't just give pulsatilla. So every remedy, ignatia, in any remedy you pick up, any remedy, naja you pick up, phosphoric acid, phosphorus you pick up, hyoscyamus you pick up. When read and see what's the connection between hyoscyamus and phosphorus. Phosphoric acid you want to give. What is the meaning of settled despair that Boric writes? Settled despair. How you will find in the patient the entire picture of that remedy comes in your mind and becomes clear. So now, if you repetize and phosphoric acid come and that picture is not matching, what do you say? The journey of the disease is not matching, the pathophysiology is not matching, then you will question your prescription. That is how you develop. That's what he was talking about: training, reading, and gaining experience. A lot of misconception about Kent I'm going to try to remove in this. So he says, Henneman has said this, and Kent was following this cause. Look at the cause. If it is a fundamental cause, my miasmatic remedy, as I gave you example of adenoids, because adenoid is a very good example. He says that many students, many children with adenoids, I have cured them with tuberculinum. Why? Because in his practice, he found out. In practice, he found out that many adenoids had some relation with past history or family history of tuberculosis. So this adenoid is not tuberculinum is for adenoids. It's not that. Like people say, fungal bacillinum is the remedy. No, there is no specificity in homeopathy. Everything has to be individualized. Why this adenoids? When you see 10 cases, you see 100 cases. And then in 70 cases, you see that everybody has past history of tuberculosis. Maybe tuberculinum is one of the remedy. Same with Basilinum also, fungal, and see past history. Then you know that, of course, now I'm not going to go into the miasmatic thing, but cause. Beginning, how did it start? Purport I told you about. Direction, which organ it is going. When you read, you know, if you're listening to me, I would urge that you should listen to Dr. Dhanipkar, Dr. Gajanan Dhanipkar. His work on understanding boric between the lines is amazing. The way he's describing the pathophysiology, the direction of the remedy, like you pick up any remedy like ammonium carb, sanguinaria, so many things are written. From where to where disease goes. Disease can start from rhinitis and ultimately leads up into a tumor. The entire journey he beautifully explains. I have not known anybody else till now who talks so beautifully about this journey of disease in pathophysiological fashion, especially by Dr. Dhanipkar. So if you get a chance, you should watch him, listen to him, Dr. Gajanan Dhanipkar. So direction and then ending. Ending. Not every remedy is going to form tumor. Not every remedy is going to where it is going to land up. Some remedies landing up into paralysis, like nervous system. Somebody is in blood, somebody in genitals, somebody in maybe uterus, somebody in head, somebody in muscles and tissues and tendons, eyes, organ, specific organ direction, and sorry, ending is only that acquaintance with sickness. So I spent little time on this just to give an example. And of course, when you're listening to me, I'll be sharing you a lot of cases slowly, and you'll find out. You'll see the similarity happening here. It's not that difficult. It's very easy. Earliest requirement, he says, what is the earliest requirement of a physician? What is it? The earliest requirement of a physician is to distinguish the symptoms that are natural or common to fixed morbid states. Should be the earliest requirement of the physician in order. Means, you know that, right? This is very simple. Again, the disease symptom and common and characteristic symptom. That he may learn to discover what is cure and unaccountable. This is what we have to understand. What is unaccountable? Accountable means, what is the meaning of unaccountable? It shouldn't have been there, but it is there. That is accountable. Or something else has to be there, but it's not there. That's the there's a word he uses, incongruous symptom complex. Incongruous symptom complex. What is the meaning of this incongruous? Strange, out of place, not suitable in particular situation. Now, again, I remember my teacher, my guru, Dr. Dhanipur, when I was learning acutes from him, in very jokingly term, he used to always say that, Manish, every case has got some nuisance. In Hindi, he used to say, कुछ तो अतरंगी होएगा उसके अंदर जो fit नहीं करता. So once you understand a case, there is something there which is out of place, which should not be there, which does not, you can't understand. The pathology doesn't make you understand. The diagnosis doesn't make you understand. It is that symptom, not suitable in a particular situation. It's out of place. Like, there's a birthday party there, right? And there's a dress code that you should wear white and black, white and black. Everybody's in white and black. And you go in red costume. Out of that entire lot, you will be spotted. Because you're in out of place. That thing has to be understood. So when we are taking case, of course, you have to understand the pathology, physiology, the mental state, the generals, but at the same time, you have to understand, we have to look for that symptom which is not there. And majorly, these symptoms are concomitant symptoms. Majorly, I'm just giving you a hint. It could be some other things also. So he says, so to distinguish an incongruous symptom complex can scarcely be expected until one is able to say what is required in any symptom totality to constitute it harmoniously. So if you want to find out that incongruous symptom, it is very important for one to understand what is required in any symptom totality. Experienced homeopathic observers know very well that. And now he said, no, this. You should know what is required in a symptom. When you see a symptom, See, patient will come and talk all the symptoms that is troubling. Because whatever he talks is a symptom. His discomfort is a symptom. But as a physician, we should know what is the symptom that we are looking for. Like he explains now. Experienced homeopathic observer know very well that burning, stinging, enlarged gland, infiltration, hardness of part, weakness, loss of fresh in a series of mammae will not lead to a remedy that will act curatively. He's giving one example, like a mammae case comes, hardness of mammae comes. So there you will find these symptoms: burning, will, stinging, enlarged gland, infiltration. This is the disease diagnosis, basically, the pathophysiology. Also that the edema of extremities, weakness, albumin in urine, and heart symptom, dyspnea, anxiety furnish no basis for a remedy for the patient. All know that remedies given on such symptoms are only expected to comfort and will not restrain the progress of disease nor very much prolong life. Now, here comes a very big question. Now, you will ask, but sir, you're just talking about pathophysiology, and now this he's saying that again, he's talking about, not to look at the pathophysiology. Now, when he says, this line when I read, only expect comfort and will not restrain progress of disease. Not now, I've been seeing so many cases, and I feel privileged also sometimes with God's blessing, the tough and the kind of very damaged case. Okay. Many cases, I accept my failures. Many cases, I am only able to comfort the patient. Earlier, it used to take a lot of tax on me. It used to text me a lot, trouble me. But now, as slowly my experience is gaining. Now I'm understanding that there are cases where you will get only diseased symptoms. And there it is important to understand those disease symptoms. Like, patient come with, so let's say, cancer of mammary, for example, or comes with maybe, some ulcers or some necrosis. You will get only diseased symptoms. When you get these disease symptoms, you can't just rule out. You have to prescribe on that. And there comes the use of your local remedies, your kind of specific remedies, the mother tinctures, the biochemics. But when you do these cases, you know from inside your heart that until I get that individualized symptoms, I will not be able to help them. And many cases, I have only been able to comfort patients with all my hard work and effort because I couldn't explore there and go there. And then I realized, first I should take a lot of things on myself. Then I realized that homeopathy always wants to cure, but Kent's 12 observation, that is why Kent wrote that 12 observation, because not in every case you're going to find that. Of course, our ultimate goal is to go deep and find those things, the individualizing thing, but there could be some cases where only these things are coming. Now, this we have to understand. So Kent is not saying that you don't look at this, but he's saying that you should know as a physician when these cases come, this is there, you repertorize those things, but you have to find out, this part, this part. This has to be understood. The cause, the beginning, purpose, direction, and ending. We are only looking at the end product. Looking at end product, we cannot prescribe. There can be a cases where we have to prescribe. I'm agreeing that. But inside, you should know that, yes, I might only be able to palliate this case. So it takes a lot of pressure out of me. Okay. So what is the question? But there could be one very valid question. Again, the question comes, oh, is it denying local symptoms and pathological symptoms? Because this is a very big question that comes, and I also have been troubled with this a lot of time. Because this sentence, when you read, and such sentences there are a lot of places in Kent where it looks like that he's saying that don't look at the pathological symptoms, don't look at the local symptoms. And that gives an impression to homeopath that yes, we should not look at those pathological and symptoms. And then when Kent is saying that, you feel that Kent, your perception is that Kent is saying that. When you feel that, then homeopath starts ignoring the pathology, the diagnosis, what is happening to the patient, where it is happening to the patient. We just ignore those things. So the question is he saying the same thing? Because earlier I said something else. I also started questioning, what is he talking? Like suppose a serous mammoth comes to me. Patient is going to talk about burning, itching, this. So I don't have to look at that. What is he saying? I can look at that. Now you'll get an answer for this. Beautiful answer here. Sickness versus the patient. Sickness versus the patient. Let's understand this. All know that the above manifestations are representatives of sickness that ultimated upon the patient. Like he's taking an example of cirrhosis of mammon. So what you're seeing right now is the representative of sickness ultimated upon the patient. But do not signify or show for the signs and symptoms of the patient. So all the symptoms that you see in local place, the particular organ, these are disease symptoms. These are sickness symptoms. Allopath will say, yes, it is bound to happen. You can't do anything. There's ulceration, there's inflammation, it's going to happen. You take this painkiller, you take the antibiotic. But these are not the signs and symptoms of the patient. And what are we looking for? The ultimate goal, if you want to cure, we are looking for symptom of the patient, not the sickness. Let's understand this. The particular of disease are there, which are common symptoms, but the generals and particulars of the patient are left out. So in a hierarchy of understanding, the generals and particulars of the patient is the most important aspect to prescribe. That's what Ken says, and I 100% agree with this. Because till we are prescribing on the local symptom, only local symptom, you repetize, you do whatever you want to do. You are only palliating or comforting or giving little ease. That's it. The ideal cure that you want, the transformation that you want, it's not going to happen. So you have to keep in mind that we have to understand the generals and the particulars of the patient. Suppressed or marked symptoms. Now it matters not whether these generals, now he says, now it matters not whether these generals and particulars are masked, suppressed by previous drugging and never existed except in the ancestral patient. They must be discovered in any case or favorable prognosis cannot be declared. We are in a section where we are trying to understand why favorable prognosis does not come. So he knows that there are problems in patient, like in cases. Many times it is masked by so many reasons. One of the reason is suppression. So many drugs people take and then it's not there. Symptoms are not coming up. He says, no matter what happens, you have to explore it. You have to wait till the time that symptoms come. Until those symptoms erupt and you prescribe on the generals and the generals and the particulars of the patient symptom, the cure is not going to happen. And that's absolutely true. Absolutely true. Absolutely true. Every physician, even a physician who is too much focused on understand the pathology, he will also vouch that he's looking for the pathological symptoms, but he knows that out of those remedies, I need to find out in patient the symptom of the patient, the symptom, the generals, the particulars of the patient where it denotes patient symptom, not the disease symptom. Till you're getting only disease symptom and prescribing on that, you be vouched on yourself that it's only going to palliate. And it is required. I'm not saying it is good or bad. It all depends on the case. We have to master ourselves in both the things. Then what to do in these cases? See, when Kent is talking, he's talking about idealism. The ultimate thing that a homeopath should do. He's talking about that. But people understand that idealism and think he's advocating only those things. He's talking about idealism to extremes. And what he's talking is absolutely true. But what happens in practice sometimes is difficult. That is why it is very important will share you his cases. Let the lecture go beyond and will share his cases. So don't keep that impression, After let's read this. Then you'll understand what exactly Kent is saying. This is very interesting. What is order from what is disorder? So we have to understand what is order from what is disorder. He says it is not to be doubted that sickness may appear in order or disorder. Many or most sickness will appear in sorry, I just lost it. Just give me 2 minutes. I just lost it. Yeah. Many or most. What is okay? Let's again do it again. What is order from what is disorder? It is not to be doubted that sickness may appear in order or disorder. Many or most sickness will appear in an orderly form if permitted to do so. So sickness also has an order. That's what he's saying. In acute sickness, all have order so that we are able to declare that course and termination. Acute, it is so easy. We know from where it started, what's happening. We know everything. Actually, it is a disorder. Like it is, everything is not in order. But the sickness acute itself is in order for a homeopath. And that is why we know how to treat it so quickly. Many chronic sickness present a form of order which is well known to an observer. So he says even the chronic diseases have an order. It is disordered, but there is order and disorder. It might look like chaos, but in that chaos there is clarity. There is definitely a clarity. And when you see many cases, then you understand. The order so far as knowable is a guide to distinguish that which presents the disease from that which represents the patient. The order so far as knowable is the guide to distinguish that which represents the disease from that which represents the patient. So ultimately, again, he says, you have to find out the order in disorder what is representing the patient, not what is representing the disease. If you get the representation of the disease only, which many cases we have to do that. I know the obstacles of cure, so many then. And there you should also know that the ideal cure is not going to happen. So ultimately, we have to try to find out what represents the patient himself. Let's understand this. Now, this is very, very, very important. Very important. And that is why, I found this article to be so intriguing. And it's a short article, but there were so many things to understand in this paragraph. And that is the reason I'm making this video. And a lot of people have told me that, make some short videos. See, I'm not here to entertain anybody. Homeopathy is a serious business for me. So entertainment is okay, but I'm not interested in entertaining. I don't do this for any other goal. Only goal is to make good long videos because I want to make you understand. Only serious people will watch these videos and make notes out of it. So I don't care, basically. I hope you understand. If the videos are longer, you can take pause. You can pause. It's on YouTube. You can come back again. That's okay. That liberty you have. Let's understand where we are going. Let's take an example of hysteria. You know hysteria? What is hysteria? Exaggerated emotions, exaggerated response, symptoms, hysteria. Now see beautifully what he says. The hysterical patient presents an incongruous symptom. Now you know what is incongruous symptom. No. Symptom complex that always deceives a neophyte. Neophyte means a new person, new physician. When he looks at that hysterical patients, many times you are deceived. Why? It seems natural to gather all those queer, incongruous fluctuations, imagination, sensation, and prescribe from that. Patient comes and he just talks. This is happening. You take everything. We have been taught. Look at the patient. take everything, repertorize everything, form a totality, take 20 symptoms, 30 symptoms. You're lost. Who has not done this thing? I have done this. I don't know you. I have done this. And every time follow-up comes, change of remedy, change of remedy. Nothing is happening. Sometimes she's looking like natremure, sometimes pulsatilla, sometimes this, sometimes that. And every remedy is looking same. Hysterical patients, my God. Who has had his lingering cases over? He has toiled for months. I had many months. While the patient improved in no manner. Yes. And the friends wondered and if the doctor was ever so be of any use. The patient comes to you for months, toiling down, and then, of course, this is the impression that they're going to get. When one has learned the nature of hysteria, he sees that he has been trying to fit a remedy to the hysteria, not to the patient. Again, the question comes, the patient. So what is the symptom of the patient and what is this hysteria? So he's telling beautifully that you are not trying to understand the patient. And then that is why those methods which talk about go deeper into the mind, go deeper into the mind, all the havocs that you create, let's interpret this. He says this, he sits like this, he talks like this, and a lot of interpretation and thematization. The entire thematization has come for these new fats, so-called neo, I will call them neo fats only. They have made big systems out of it, and a lot of homeopaths are following it, and they are dooming themselves. Their future is being doomed because you don't get results in that. They're not able to understand because everything they talk about a delusion, they talk about dreams, they talk about some anxiety. Everything looks like an important symptom, but those are not important symptoms, especially the mental symptoms. Very important are mental symptoms for prescribing, but you should know what mental symptom has to be taken. The symptom of the patient. There's a very good article, Bogar Generalize Repertory. Senior Dhawale has written a very good preface there. You should go and read. If you get time, you should read. Bogar General Repertory. You can download the PDF from Google. Just read the entire introduction that he has written about mental symptoms. You'll be mesmerized. You'll be like, wow, what amazing thing he has written. And then you'll understand so many mistakes that we do when we are too much ingrained in understanding the mind symptom, going deeper and deeper, and doing all the surgeries and all anatomy there. Ultimately, you just fit the remedy to hysteria, not to the patient. So what is the symptom of the patient? The writer has been asked to prescribe for cases many times when symptomatology was beautifully presented, where hysteria was there in all of its richest neurological exaggeration, but not an idea could be drawn. So neurological, see, hysteria means exaggerated emotion. So all neurological symptoms come up. Hence, all numbness, tingling, anxiety, fear, phobia, everything comes up, and you get confused there. From it to portray the state of the patient. He says all the neurological exaggerations were there, but Kent says I couldn't find out anything which would portray the state of the patient. Such a case remains incurable until the symptom that stands for the patient are also known. Now the next question is, what are you talking about? What is the symptom of the patient? What is it? These generals are found if they are discovered to be what? The changes of desires and aversions. The changes of desires and aversions. Love and hate. He just says two things. The changes of desires and aversion, the loves and hates. If you want to know more about this, you can go and watch my introductory lecture on Kent. There, Kent has given the first lecture or second lecture. I have already talked about what is the general symptom of the patient. There are 7, 8 things what he talks about. These are the general symptoms. That's it, nothing else. Other than this, whatever you see is useless. So the real fight, real challenge for a homeopath is to find out the symptom of the patient, backed up with the pathological changes, not throwing away the changes that's happening. What is happening in the patient is also important, but the patient symptom is also very important. These are most difficult to secure as every hysterical patient conceals her love, real loves and hates, relates such as are not true for of her. Hence, it requires skill, power of experience, strong mind, which cannot be deceived to question her when she lost her guard. And here comes the skill of a homeopath who has been trained in this, who has seen so many cases, maybe failed in so many cases, and he can catch her off guard and ask those symptoms. This case is incurable until the case is being taken in a manner to present what is true of the patient. So symptoms, what is true of the patient has to be taken. It is always true that what is predicted of the disease is easy to secure, but what is predicted of the patient comes out of under difficulties by cross-examination or accident or wrong observation. So the symptom of the patient, sometime you have to cross-examine very nicely. Cross-examination, I just remembered in Alan's keynote preface. Go and read Alan's keynote preface, the first paragraph. He says the only duty, the responsibility or duty, the lifetime work of a homeopath is to continuously compare and differentiate, compare and differentiate, compare and differentiate. So ultimately, it boils down again to the knowledge of mud remedy. Case taking is one aspect, collecting data is one aspect, differentiating them, making totality is one aspect. But ultimately, the people who are more thriving on understanding the drug, who read drug more and more, invest their time more and more, even before prescribing, they read more and more the remedy. Try to understand the remedy. It takes time, I understand, but try understand the remedy from various aspects. Classical way, not thematizing way. Classical way. Kent, Clark, Boric, Allen, Spartak. And continuously you cross-examine, Pulsatilla, Bryonia, arsenic. Every time you differentiate. The life work of a homeopath is there. So that is one. Second, sometime by accident. Accident means sometime acute comes in. Or accidentally something patient says. You have to grab that. And another is prolonged observation. Sometime when you're observing a patient for 3, 4, 5, 6 follow-ups, you're observing, and then ultimately you understand, oh my God, this is the symptom that I was analyzing was superficial. This is the real symptom. And that is why, some physicians keep patients under observation. IPD. Yes. Now I understand why they want to keep patient in IPD setup. Because they want to observe everything what patient does. Prolonged observation sometimes gives you the symptom of the patient. So now the question again comes that, is Ken talking? I asked myself this, is Ken talking about ignoring disease symptoms and pathological symptoms? Again, the question came that, because this is such a valid question, because this has actually divided the homeopathy into two parts. There are people who just say pathology is not important, and they just understand the mind and theorize, and systems after systems have come. There are people who just say, oh, just look at the pathology, just look at the pathology, and they are just looking at the pathology. And a homeopath thinks, oh my God, sometimes it feels this is right, sometimes it feels this is right. Where do he go? And people who talked about other aspect, they always claim Kent. They always say disease in patient is not important. The person in the disease is more important. They take that slogan. So my confusion is because see, I'm reading everything. I have due respect for Kent, at the same time due respect for Boger, Boddinghausen, Boric, Clark, everybody, even Herring, everybody. Not everybody can be completely right. Now Kent has done so much work that his philosophy is really the base and foundation of homeopathy. So let us clear this confusion. So this question came to my mind again, that again is Ken talking about ignoring the symptoms and pathological symptoms. Now see what happens. Now this is what Kent is writing there. Let it not be supposed that symptoms that are predicted of the disease are to be ignored or considered valueless in selecting the remedy. Who is writing this? Kent is writing in his lesser writing, my dear friends. And we feel that Kent was against pathology. Kent was again disease symptoms. See what he's writing. And now he gives you the way how to approach a case. Let it not be supposed that the symptoms that are predicted of the disease are to be ignored or considered valueless in selecting the remedy, but they are to be considered subsequently to the symptoms that are predicted of the patient. He only says that the disease symptoms, the pathological symptoms, whatever he called, is important. It is not valueless. It has to be, only thing is, they have to be considered subsequent, means next to the symptom predicted of the patient. So first individualize the patient, but once you individualize the patient, you have to look for the pathological symptom. And again, I'm coming to the same point. Go and read Kent Mater Medica. Go and read from this aspect. Now go and read Mater Medica, and you will find that every remedy, the lectures that Kent is talking about, he is describing the nervous system, the blood system, the kidney, the mental, mental illness in the brain affection. He's talking about tissue changes. He's himself talking about the pathological changes. But he's not saying renal stone give berberis. That is what he's trying to avoid. So that is also one of the way of prescription. I'm not saying there is right or wrong, but the idealistic. It has often occurred that a remedy has made brilliant cures when it suited the patient, even though it was not known to possess a strong likeliness of disease. And then he says one more very important aspect. He says that, and people have picked this thing. See, now he's saying that disease symptoms should not be ignored. And then he says there are times when symptom matches the patient. If disease is not given in the book, still it will work. And this is true. Why? Because many of the remedies, it's not because, see, understand this. It might seem contradictory. No, it is not contradictory. He's saying that the first thing you have to understand is the patient, the general symptom of patient. The remedies are not proved to that extent where the disease symptoms have appeared. All the disease symptoms, the pathological symptoms that you try to understand are toxicological symptoms. In our Mater Medica, a lot of symptoms, are toxicological data that has been collected. So when you rely completely on toxicological data and always want to match the pathology is also a wrong way, but it has to be considered. So when you understand this, like give me an example, liver cirrhosis, nobody, proving gets liver cirrhosis. Nobody gets liver cirrhosis. Nobody gets gangrene in proving. But then there are clinical symptoms. Like when you open Clark repertory, you'll get a lot of clinical disease symptoms. He has written diabetes, uric acid, rheumatic. Those things have to be considered. But there could be so many remedies whose pathophysiological things are not being addressed, not being found out, because we have not been trained to find and have a data of toxicological, toxicology of every remedy. That is why I was talking about Dhanepkar sir, that he's doing a very good job where he's trying to find out toxicological connection of the remedies. And if you're really interested in that, Boric is one of the books that has to be read and understood. So, but now coming to us as a homeopath, the suited thing has to be the patient. The patient symptom first. So try to understand the patient first, and then it has to back up. He says if likeliness of disease is not there, don't worry, because it could be possible that in that toxicological data is not addressed or not noted down. It could be possible. I hope I'm not confusing you. And of course, I'm not confusing you. There's such a good clarity. Ultimately, the point that I want to make is that everything is appropriate in homeopathy. There is no bifurcation. People use one of the sentences and they create. My only trouble is the theorization that has happened in homeopathy that is spoiling down. Let the likeness be the first to the patient and last to the disease. That's what he says. Like mammoth tumor, he said. Now, when you put mammoth tumor, you will get only 5, 6, 10 remedies. I've been doing this since ages. Years, not ages, sorry, year. If you just look at the end result, you will get very few remedies. Maybe you are lucky, you can understand those remedies and will be able to give. But again, he's trying to say, when he says, look at the symptom of the patient, what is he trying to say? Look at the end result. Okay, look at pathological changes. Okay, but why is this happened? From where it has happened? Go back, look at the person. What stupidity he has done in his life? What emotions have played in his life? All the suppressions that he has done. Understand what soil he has come from. What is the soil? Past history, family history, miasmatic traits. Those things understand first. What disease suppressed? Where from the disease the metastasis happened? That is what Kent is trying to explain. The patient is first and the disease is last. It is like initiation. And now this is very interesting. 3 words he has said, and this is beautiful. It is like initiation, direction, termination. He says, understand patient first, disease last. He said disease is last. But he talks about all the aspect. He says initiation. Initiation means from where the disease began. And then direction. The where it has passed, the metastasis happened. This organ, then this organ, then this organ, then this disease, all the situation that he went through, all the mental traumas that happened, all the general symptoms that vary. In female, the suppressions happened, the menstrual irregularities happened, iatrogenic disease happened. All those things has to be taken into consideration. And ultimately, the termination means the end result, where he's landed up. From A to B, A to Z, sorry, A to Z, everything has to be understood. I hope that is making a lot of sense. I know. If you're watching this video, please comment. Please comment, because when people comment, it motivates. If it really helping you out, definitely you should comment. It will motivate me. Okay. If only disease symptoms are there, for example, now he gives another example. In perspective, Thysical patient, like tuberculosis patient, we see patient with few symptoms of the patient himself. Okay. But weakness, loss of flesh, anemia, coldness, tired of all exertion, bad reaction, easily disturbed by eating, drinking, exposure, loss of sleep, weather changes. These states are common to so many remedies that it will at once be seen the patient is not represented, and no promise can made, though there is no signs of tuberculosis. So if you see it, this kind of patient, tuberculosis or these symptoms, so many remedies are happening. But until you individualize the patient, you know that you are just palliating. And then he says the favorable prognosis must be withheld until. Now, we are at the end of the session. Now we will get your answer. Somebody will be thinking, okay, sir, we understand, and Kent was not against pathology. We understand now what Kent is saying. But when I'm seeing my cases, I don't see exact thing happening like that. I'm always wavering around. Sometimes only disease symptoms are more, common symptoms are more. Sometimes few general symptoms are there. It's so confusing what to do. And now he gives you exactly what has to be done and approach in the case. He says, a series of carefully selected remedies had been used. He says a favorable prognosis must be withheld. Means it is not going to happen until. A favorable prognosis will not happen until, withheld until a series of carefully selected remedies has been used. And the symptoms that represent the patient begin to appear. People say single remedy, single dose, you get your answer here. So there could be cases which are being suppressed, which only common symptoms are there. So he is talking about layer by layer theory. So series of carefully symptoms has been used, and symptoms that represent the patient has begin to appear, such as the mental symptoms, the other general symptoms. Now this is the summary of this lecture actually. So ultimately he says you will get those cases. Of course, you should keep in mind that you have to understand the person, but many times you have to have series of change of remedies in those complicated cases. And when you keep changing the remedy slowly, good mental symptom will erupt. In between, some good generals will erupt. I've seen so many cases of Sarkar, sir, where he's prescribing, and suddenly patient comes and says, "Oh, doctor, I've got excessive craving for meat, excessive craving for salt. Oh, doctor, I've got sweating, lot of sweating started in one side of the." Those cardinal general symptoms, which are out of proportion, it cannot be explained. This will come in follow up. And when it comes, that is a time you know that yes, you're being able to remove the layer by layer and real picture is coming up. So many times it is being suppressed. So hence it is important. We have to understand the use of biochemics, the mother tinctures, maybe the, what do you say, pathological symptoms. Now you understand. Now you will understand why Boger is important, why BBCR is important, why FATAC is important. Or maybe sometimes specifics might be help. You have to use specifics, maybe. So a homeopath has to train himself in every aspect, individualizing the case, the miasmatic understanding, the pathological understanding, toxicological understanding. When you empower yourself in this fashion and then slowly, steady. Of course, we are always guided by signs and symptoms. And gradually these symptoms will erupt. And when in cases these symptoms erupt, the good mental symptoms, the general symptoms, and then you know that you are on a right track. So what is the conclusion? Conclusion is, what I understood is, he talked about layers of remedy. Burnett's theory. Now, Burnett is the person that he's talking about. Now, people will say, oh, who know me, they will say, oh, you made this lecture because you wanted to uh, propagate Burnett. No. I didn't have this in mind. See, Burnett I have done and it's kept aside. But ultimately, when I came to the end and I said, my God, what is he talking about? And it's exactly the thing that Burnett did. So what Burnett did and what Kent, I have made many lectures on Burnett, sometimes, I think one video also I put Kent and Burnett, there's a merger of Kent and Burnett, something like that. You should go and watch that video. I had made this video long back. And today when I read this, then I understand what they did. Like, forget about Kent, Burnett, forget about that. As a homeopath, my job is to help my patients. So I will try to get all the nuggets of the best people. So all the pioneers, whatever good work they have done, my job is to take the good pearls from them, the nuggets from them, and make my own shell of nuggets. So I don't see any difference that Burnett was talking was. People say, oh, Burnett was specific, oh, Kent is different. No, they both talk same thing, if you understand. Kent was not against pathology. This idea has completely got out of my mind. Kent was not against pathology. He talked about idealism. The idealism is that he says person in the disease, individualize. But now it all depends on the cases, the type of cases you see. Hence, it is very important for you to investigate scientifically and understand the pathology. So Kent was never against pathology. People say Kent was not a pathological prescriber. I will not agree. I've given you multiple reasons out of it. But what Kent talks about the idealism that has to be kept in mind along with the pathological understanding. Learning and understanding Mater Medica in right sense. And ultimately, it boils down to this, that we have to learn and understand our Mater Medica. More you will read, I'm telling you, more you will read Kent's Mater Medica, Borek's Mater Medica, more you will read and understand the remedy. Before prescribing, just read the remedy. Look at the bold and italics, at least underline once. And then once you engrossed yourself too much in understanding Mater Medica, you will definitely be able to understand what is happening in the patient, what these pioneers did. And then favorable and unfavorable results. You'll be able to distinguish, you'll be able to predict in which cases I'm going to get favorable results, which cases I'm going to get unfavorable results. So here I end, and this was a short video. Of course, it's not a short video, it's a long video. But the idea of putting this video in front of you to all my colleagues and students was some ideas, some thought process. This is what I thought. Maybe I'm not 100% correct, but this is what I thought. I'm always in search of answers in homeopathy. And maybe that search leads me to go deeper into these things and try to understand. And whatever I feel I want to share to this world, thanks to this social media, I want to share it. And please listen to it, think about it. The idea of sharing is not to teach, the idea of sharing is to make you a good thinker. Because if we become good thinkers, then it is very rare that people can come and misguide us. Problem is we are not thinking. God has given you brains. Friends, think, analyze, and let's make this world a happier world through the aid of homeopathy. We need good homeopaths with good clinical skills because a lot of sufferings out there. We have people are looking at us. We have got a lot of scope. But yes, we have to keep on polishing our things and keep doing hard work. Thank you very much. Bye bye.